So, how do you know if you need therapy? This is one of the most common questions that I get as a clinical psychologist. People asking me, well, I know that, I deal with certain issues and sometimes things frustrate me or bother me a little bit more than I think they should. But how do I know if it has reached that point where I actually need therapy? And so everybody knows, well, everybody can benefit from therapy, right? That is sort of understood, I believe. But when does a person actually need it? This is what I can speak to today in this video. And I think that the most clear answer is when you feel like there is a pattern of suffering, when you feel like there is a pattern of symptoms, it's not just a one time thing. It's not just some isolated incident. You feel down or bad or angrier than usual, for example, for just a couple of days. A lot of people have little short term slumps. But when you have a lot of mental health symptoms, maybe feel depressed or any number of things, and you find that it's lasting, a couple of weeks, for example, well, that is definitely a pattern. And a lot of times, another sign that a person really needs therapy is when they feel like whatever symptom that they're dealing with, they can't escape it. They can't get out from under it. Imagine like you feel like you're trapped under something heavy and you can't wiggle out of it. It's like this cloud that sort of hangs over your head. Well, when people go into therapy and they actually do have a mental health diagnosis, usually they feel like it has impaired parts of their life where it is preventing them from doing things that they want to do or preventing them from doing things as naturally and easily as they feel they should. So, usually there is some sort of impairment in school functioning, in work functioning, in social functioning. Somehow, any of these relationships or activities just become more difficult than people really feel they should. And the other thing that I would mention is that I think that a lot of times people also have instincts about things. So there are some times when deep down, if we are really honest with ourselves and we ask ourselves, hold on, do I think this is more of a problem than I want to believe it is? Do I think that I probably do need help with this particular issue? Well, a lot of times our instincts will tell us, yes, this is more difficult than it probably should be for you. You are suffering more than you probably should be. And this is something that rises to that level where you could seek help from a mental health professional. Now, one of the most important points, though, that I want to highlight here is that when people think about needing therapy, when people ask themselves, well, how do I know if I need therapy? It's really important to look at the way that you're thinking about therapy. Therapy, is it just this giant metaphor of this big, scary clinical building that you're approaching? Oh my gosh, am I going to go in? Am I going to get trapped there? Will it last forever? What kind of can of worms will this open up? Will I start looking at things, other parts of my life that I didn't really want to focus on or didn't even know were making me unhappy? Now I realize, oh my gosh, I've opened up this whole can of worms and just my whole life feels like it's spiraling. And now I need to change everything. These are a lot of times the fears that people can have about something that is really unknown to them. If you are someone, for example, who's never had therapy before, it would be hard for you to know exactly what to expect. One of the things that you can do is reassure yourself that when you go into therapy, it really can only be as long as you want it to be. If you're going into therapy, it's a voluntary experience that you're seeking out. You can decide when you stop. You can decide if you want to go in for just a few sessions or if you actually want to go for longer term. I can share, for example, for myself as a psychologist, sometimes I see people just for 2 or 3 sessions. Sometimes people just want a check in where they can check in and talk about something specific that's going on in their life, get help with something that is sort of like a crisis or something that they've really tried to figure it on their own. They've maybe talked to a couple of family members or friends, and they just feel like they want still an outside opinion, but they don't want to do a year or 2 years of therapy. So, maybe they go in for 2 or 3 sessions. You can always look at therapy as an option like that too. You can try therapy for a session. So don't think to yourself, well, if I go into therapy, I'm going to get stuck in it. Just remember that your mindset about therapy and what the experience will be matters a lot. It is important, the mindset that you use to frame this. And so you can say to yourself, well, I'm going to go for a session. I'll see how it feels. I'll see how my connection is with the therapist. And I'll try to get a sense of what ways they can help me, if they have any techniques or tools that they can share with me. I'll see afterwards how I felt in that experience, how my body felt. Did I feel relaxed and calm? Did I feel like this was helpful? Did I feel like this was good problem solving for me? So you can just go to one session and see how you feel. Maybe you stay for a few sessions, maybe you stay for longer. But this is the mindset that I think is really helpful when people ask themselves, how do I know if I need therapy? Well, first of all, remember everyone can benefit from therapy, but needing therapy is really about suffering or symptoms lasting as a pattern for, a week, 2 weeks, or longer. And really saying to yourself, well, when I do go into therapy, when I do talk to a mental health professional, I will do it for a session. I will see how I feel, and I will make sure that there is a good fit between me and my therapist. All right. I hope this helps. You can also check out a lot of my other self help videos on my channel here, Dr. Seth Psychologist. Have a good one, everybody.